Hi, I'm Dr. Narda Robinson, President and CEO of Curacore Vet and Curacore Med. I'm here today to talk to you about the untold story, integrative solutions not taught in veterinary school. And just a reminder, I am a veterinarian and an osteopathic physician. I taught at Colorado State University for 20 years, and now we work with various other veterinary schools as we teach our scientific and integrative medicine courses and just workshops. And so I've seen quite a few schools, and there are improvements happening across the nation in the schools. There's more rehabilitation, sometimes there's acupuncture. Unfortunately, sometimes there's traditional Chinese medicine. And so we have our webinars on those kinds of things. But today I want to more put it all together and to reach out to vet students, new grads, even old grads, and just talk about how we might collectively improve the contents of the curricula in veterinary schools so that they more appropriately and meaningfully relate to what the needs of clients and their animals are regarding having more options for treatments for conditions such as seizures, which we'll cover today. So this sub-series, The Untold Story, will happen throughout our webinar series and have that theme of what else can we be doing, what else can we be teaching in veterinary schools. And if we're not going to do that and we're going to say everything's good and the amount of drugs that they learn about and surgeries and everything, if that's what should be happening, then maybe we can have a parallel pathway for training, which with Curacore, what we're doing is PVM Prima, so professional veterinary medical training in PRIMA, the Pain Rehabilitation and Integrative Medicine Advantage program. So that gives students an opportunity to learn science-based integrative medicine while they're in school in a horizontally integrated curriculum that is also vertically integrated. So when they're studying things like anatomy and physiology, that we're introducing them to the anatomy and physiology of acupuncture and photomedicine, and then later in massage. And then as we teach botanicals, then they are at the same time learning about pharmacology. So it's just what should have been extended, but I realize there are constraints on time, and faculty often don't even know anything about science-based integrative medicine. So we're helping to fill in that gap. And so here's our inaugural episode with talking about seizures. So what is taught in veterinary schools about seizure disorders? And specifically what I'm going to be focusing on is canine epilepsy. And then we will proceed into what isn't taught about seizures that can help us do better and to upgrade things. So that's the general layout of our approach today. So for poll number 1, because we're going to have polls today, I want to ask you, which treatments did you learn how to provide for epileptic dogs in veterinary school? And so we have medical acupuncture, botanical medicine, including cannabis, massage or acupuncture or acupressure, photomedicine, which would be laser and LEDs, or none of the above. So I'm going to launch the poll, and you can answer more than one question, like have more than one answer, because I think I made it that way for you. And we're just waiting for a few more votes to happen. Poll is in progress. We'll give you about 10 more seconds. All right. So, and yeah, what we saw was 100% of you did not learn anything about acupuncture, botanical medicine, including cannabis, which doesn't surprise me, massage or acupressure, or photomedicine. So that's why we're here. And that's why it's important to continue to critique and modify and upgrade our veterinary school curricula. Unfortunately, I don't know how often that gets done, because the people that learned it a certain way then rise up to the administration, and then they're like, well, we learned this a certain way, or you delegate what do you want to teach to the people that learned it a certain way. So there's not, in my mind and experience, a lot of moving air through things unless something maybe radical happens or you have a really progressive dean or something. So I'm going to hide those results. And that's pretty much what I suspected, is that it's just not taught. We were changing that at CSU while I was there, and then since I'm gone, I don't see much of that going on. But anyway, so things change. So let's change with the times. I mean, just like women's dress, and you can see here over the decades or centuries. And nowadays, it could be that you have either polo or scrub shirt and, pajamas on the bottom. So things do evolve, and our treatments should as well. Okay, so epilepsy in dogs, what is it? It's the most common chronic neurologic disorder that we see in dogs. And up to about 5% of just the regular population of dogs has epilepsy. But if you're going to go to then a neurosurgical and neurologic practice, then that's of course going to be artificially higher. And I call it a type of term that we use more in human medicine, which is a wastebasket diagnosis. It's just this catch-all category that really doesn't tell you much about the causative factors of it, so the etiology or patient-specific care. It's like, well, it ain't this, it ain't that, ain't that, and this whole list of other things. So what you have is epilepsy. Idiopathic is, I don't know where it's from. And then some people will say, well, it's genetic, but how do you know that either? So maybe it's inherited, but maybe we don't know for sure. So then it's further defined as having two or more seizures of brain origin occurring more than 24 hours apart. If it was closer, it'd be cluster seizures. And the seizure characteristics are similar from one episode to another. And the physical and neurologic exam tends to be normal between seizures. And then you do your blood work, and we'll go into that a little bit more later, and your analysis, and that's all normal too. So what is an epileptic seizure? What does it look like? It's an abnormal, excessive, or synchronized neuronal activity, expression in the brain that produces these transient signs. And again, have at least two unprovoked seizures more than 24 hours apart, might fall into one wastebasket or another, so idiopathic or genetic, and then tends to be more common in the younger purebred dogs and in males. And about a third of the dogs, if you go long enough, can be eventually diagnosed with a structural or metabolic cause. But again, as we've said, they tend to be neurologically normal between episodes. So it's not something like a brain injury or cardiovascular disease or something that is going to show how they're not just feeling well in between times. But as it goes on, the severity can worsen. So the two types of seizures that we generally see are focal, so affects one part of the body with or without consciousness. So you might see like a something in the face, a tic or a licking of the lips or something, or an abnormal movement in one part of the body. But then with generalized, then they just kind of stiffen. So tonic or clonic is they would be paddling, but they do have loss of consciousness. And then you're going to see a postictal phase where they're tired and they're just out of it. So very different expressions of seizure disorders. And if we look at what else causes seizures besides the idiopathic genetic, I don't know, cause, then if we can identify it, then it can be infectious or inflammatory, neoplastic, so some kind of tumor either in the meninges or in the brain tissue itself. It can be a congenital disorder, metabolic issues, vascular disease, cardiovascular disease, or trauma to the head or some kind of injury. So those are generally the other baskets that we can put people or dogs into. And then sometimes you just need to go to urgent care. Status epilepticus, so it's just lasting longer and longer. It's just not stopping. That's no good for the brain if it does that. And if that would be a recurring theme, then you would maybe get some Valium solutions so you can administer intrarectal Valium or something else to stop the seizure, because you really don't want it to go on. And if it keeps on recurring, then that's a cluster seizure. That's no good either. So what do we do? We're going to rule out those other causes that I listed that could be responsible and therefore treatable as something specific rather than something generally, like we're going to just dampen down your whole brain function, which is what else would happen. And then, as we said, we're going to take a methodical approach to figure out, is this in the brain or not in the brain? Do we need to do a magnetic resonance imaging? Do we need to do spinal fluid analysis? So the investment in working it up can get quite expensive, and not to say you shouldn't necessarily do that. But as with other things, if we have the opportunity to do something clinically meaningful and scientifically based and evidentially informed, then as with a pain problem or something else, we might, if there's no reason not to, we might pursue an integrative medicine approach. If you are forward thinking and learned how to do that, whether in school, which most of you haven't, or out of school, where you can pursue further legitimate, rational, science based training. So, additional assessments, you want to make sure their blood pressure isn't going bonkers. You want to look in the eye. In a human, you do a fundoscopic exam and look for elevated intracranial pressure. I would hope that you would do that with the dog too, but I don't know many that have. But if you had an ophthalmoscope, a higher advanced kind of thing, and you could get that exam, it's nice to see whether that intracranial pressure is elevated. Then you would do liver function tests. That's going to be something that should be followed anyways if you would be starting medications, and then a full thyroid panel, make sure there's nothing involved with that, and also be able to get a baseline for future reference there. Are they diabetic? Did they have a hypoglycemic episode? What's going on? Rule out infectious organisms to the best of your ability. Make sure their B12 level is okay. Their ionized calcium is within normal limits. Test for toxins. Did something happen? Are they increasingly exposed to something that is making them ill neurologically? And then potentially an electroencephalogram, but I don't think that's widely available for many clients. So when we get to the treatment, and I kind of surveyed what was out there from either veterinary schools or resources that are educational or research based or just supportive of the industry, where there are these articles in various trade magazines that are like, here's how you treat such and such, which also kind of makes me wonder. I mean, it's nice to have sort of a magazine that tells you how to treat things, but it's also weird a little bit that you have a very industry funded with all the advertising approach. I mean, I've written for them, so I guess I shouldn't criticize, but it's just how much of what is done out there was learned in a certain way versus leafing through a magazine. I don't know, another webinar episode maybe. But so here we go again from these resources. A quote: "The administration of anticonvulsant medication is the foundation of therapy." So, okay, you're in an approach that it's like, let's go right to medication because that's the foundation. And so if you didn't learn medical acupuncture, botanical medicine, including cannabis, massage or acupressure, or photomedicine in school, or anything about music therapy, aromatherapy, anything like that, that talked about the neurophysiologic modification of these therapies and how it might match the mechanisms that are needing to be righted in the brain, the neurophysiology, then you might be like, yeah, what else would we use? Better living through chemistry. That's the source of another webinar focus upcoming. But just like, well, we are a vat of chemicals, aren't we? So we must be missing some phenobarb or some Keppra or something, because obviously we're having seizures, and what else would we do? So they go on. The goal of this therapy is to reduce the frequency, length, and severity of seizure activity as much as possible. Okay, fine. Yeah, if you need to do that, what else are you going to do? While minimizing adverse drug-related effects. Okay, let's talk about those. Epileptic dogs that are either not treated or treated inappropriately may have an increase in seizure frequency, duration, or severity over time. So it makes you think that we have this body of literature, including a body of evidence, that is really strongly educating our professionals about the proper treatment of epilepsy because of all the studies that have been done, of all the research out there on each drug with different populations of dogs that show the effectiveness. And so these statements were from this sort of compilation, treatment plans for routine and refractory canine epilepsy, that just comes across one's inbox. And I thought, well, that's timely, so I'd look at that. Today's Veterinary Practice. But that's one of those trade magazines, and nothing wrong with it. It seemed to have good conventional information that sums up the field, but it's still evidence of us having this narrow focus that is what you as a vulnerable veterinary student just poured into your brain, and you weren't going to ask questions maybe about, would acupuncture work? Uh, so anyway, so here's what you learn: when to begin anticonvulsant drugs. When you have 2 or more seizures within a 6-month period, when you have status epilepticus, cluster seizures, which we've talked about, a severe or lengthy post-ictal period, so after the seizure, increasing seizure frequency, severity, and or length. So, these dogs are then put down the road of drug management, and with some of them, it's kind of hard to get off. Once you're on phenobarb, for example, that is changing some of your seizure thresholds. So it's not just something like, I'm going to take an Advil today. Of course, the dog wouldn't do that. But here in that same paper I talked about from Today's Veterinary Practice, as they say, the authors there down below, currently evidence-based guidelines regarding the choice of anticonvulsant medication in dogs are limited. So there have been a couple of consensus papers out there, one from the UK and one from ACBIM, and that was in 2015. But there's really not a lot. If you look at the studies that have been done, there's maybe 10 dogs in many of them. This one study we'll talk about later had 50 dogs. And so just remember that if you are a science-based integrative medicine practitioner, when some practitioner, surgeon or otherwise, comes at you and says, well, where are the studies? Remember, as I've remembered during some of my lectures at meetings, like, well, doctor, surgeon, how many of your studies are randomized, double-blind, placebo-controlled? Thank you very much. And even they don't seem to realize, because they're like, well, it's all double-blind, placebo-controlled studies. Right. Let's get back on that when you do your homework. So anyway, and as they say here, ultimately each dog is managed on a case-by-case basis. Now you have integrative medicine practitioners say that's like, oh, whoa, how can you do that? Some dogs with acceptable seizure control may have serum drug concentrations below the lower limit of the reported therapeutic range. Well, now that's not going to help your pharmaceutical company sell more drugs. And so perhaps you would be sometimes told, well, they have to be within this limit. It's not only the pharmaceutical company, it might be Joe Schmo or Jane Schmo, veterinarian, that is looking to improve revenue. Not that they're all or you're all doing that, but it's not unknown that you might want to, or somebody might want to sell more products out of their place. So in that, versus physicians, in that veterinarians have a pharmacy in-house and you have this whole nutritional center and everything and who knows what else, it is different than a physician, because you're making money off of making recommendations for stuff. And sure, there are chiropractic offices. Maybe nowadays they're allowing physicians too to have radiology centers, which is then a conflict of interest too. But that's just a little something that I don't think has been covered enough in our profession. But anyway, this finding does not necessarily require adjustment of the drug dose or dosing interval, as a lower than has been told to you by great academia or great drug company. A lower level might be adequate for that individual. So it's about tailoring again. Yay for that. So when one is thinking about treating with pharmaceuticals, and I suppose even if you're thinking about treating with integrative medicine, you should be thinking about the safety, the ease of administration, potential side effects, right? No matter what you're doing, that sounds reasonable. How effective is it? How easy is it? How to give? How well received is it? Safe side effects, interactions with other xenobiotics, whether they're drugs or herbs. What's the half-life? So how often do you have to administer this? We're not going to do acupuncture 3 times a day, right? Regulatory issues. Is it an approved medication? Is it controlled? Is it illegal, legal, whatever? And then there's more things to consider. What other comorbidities does the patient have? So is there going to be a deal breaker because of pre-existing liver problems with this animal or renal problems? What about, is the client home all day, as many of us have been? Or are they away most of the day and can't administer a medication or whatever needs to happen multiple times? So that's going to change things. Financial considerations, some of the drugs can get quite expensive. And then seizure type and frequency, what's really going to work? So just some of the most common anticonvulsant medications that are out there is phenobarbital, Keppra, zonisamide, potassium bromide, gabapentin, and clorazepate, used somewhat differently for different indications and types of seizures, but again, not huge amounts of evidence for specific populations in dogs for any of them. And then the problems with them, like phenobarbital, this was shocking to me. It's only been approved for the treatment of epilepsy in dogs since 2009. I graduated 12 years earlier, and they were using it, but I guess it finally got approved. And it's effective in reducing seizure frequency in 85% of dogs with idiopathic epilepsy. And here they're saying if you keep the plasma concentrations between such and such, but conceivably, dogs could get seizure control with less than that. Dosed 2 to 3 times a day, and then you have to assess phenobarbital serum concentrations 2 to 3 weeks after starting the therapy, and then test again if there's any change or if the treatment isn't working well, and you do those blood work tests again, phenobarb levels every 6 months. So that, I mean, that gets people in, but it still requires some vigilance and some going back to the vet. So that's, I mean, I suppose that's okay unless it's really stressing them out. We'll get to that later. And then you might see low serum levels for dogs that are on phenobarb. So what does phenobarb do? And we can think back to our cannabis webinar and talk about the increased serum alk-phos levels with CBD and how people are like, oh no, what are we going to do? Increased alk-phos levels. Oh no, it's horrible. Well, you see it with drugs too, and we don't know the significance yet in CBD. Increased cholesterol, increased triglycerides. So those are some of the changes that happen. What about drug interactions? And we have talked about the notable herb in prior lectures about of St. John's wort and how that interferes with the metabolism of a whole bunch of drugs. Well, so does phenobarbital. And how many times a week, let's say, do clients in a given practice that are receiving this how much education do they get about herb drug interactions or drug drug interactions just in general? Because phenobarb is a fairly common drug to use, but if you're going to combine it with other anticonvulsants or antibiotics or anesthetics, I mean, there's just so many different interactions. And if you go to drugs.com, you can see there's 662 drug interactions that they alone list. And it's not necessarily that it's interfering with metabolism, but it might be that they get hypersedated, like with methadone, or just any kind of other mechanism. But it's something to watch for. So side effects with phenobarb can be polydipsia, polyuria, lethargy, increased appetite, and ataxia. Wow, that's fun. Uncommon adverse effects, bone marrow suppression, severe hepatic injury. When was the last time that you heard about acupuncture causing bone marrow suppression or severe hepatic injury, short of sticking a needle in the liver, which you don't even do? Acupuncture, massage, photomedicine, any of the integrated medicines, if we can see how they might work and make a case for that and give it a try, you're not going to get polydipsia, polyuria. You might get some momentary lethargy as person or animal is relaxed after the treatment. They might feel better and they have an increased appetite temporarily, or you think of a cannabis product, but you're not going to get profound ataxia with these things unless something was really, really wrong. And here's Keppra, the chemical description of that. It's a newer one, and it's generally well tolerated, and the research says it reduces seizure frequency in some dogs. Okay, I mean, okay, might be better as an add-on drug because this is what has stimulated all the enthusiasm for a cannabis product for epilepsy, because we see how many children with congenital disorders have been helped with it in the studies that are coming out. And when I was at CSU getting cannabis research off the ground there, and we started our first study, which was just a survey of the customers for Canapet, then seizures was one of the main things. Seizures, anxiety, pain, and cancer. This was way up there because people don't like the profound sedation that happens, the ataxia, the "this is not my dog" kind of perception. It really impacts the relationship to have that going on. And so they have often found benefit with a hemp based product. Sure, you could conceivably get a seizure with a THC overdose, but or just a lot of brain changes. But with CBD, it'd be really hard to overdose that, and I wouldn't suggest trying that out. But then, if you are going to use Keppra as an add-on drug, then because of phenobarb and other chemicals causing this induction of the cytochrome P450 enzymes, then you'd need to have an increased dose. And as it says in some of the literature, no current therapeutic guidelines for dogs as yet. And it's an expensive medication. So what they call mild adverse effects are ataxia, sedation, inappetence, and vomiting. Kind of sounds like your phenobarb. And serious adverse effects, not a lot published, but this was a case report from 2018 in a Chihuahua who had cluster seizures and tachypnea. Now, maybe there was something going on previously in the lungs, but given 60 mg per kg undiluted Keppra, and he immediately became tachycardic, hyperglycemic, hypotensive with delmentation, succumbed to respiratory failure requiring mechanical ventilation, and then had a heart attack and died. Had pulmonary infiltrates with inflammatory cells on necropsy, pulmonary edema, and interstitial pneumonitis. Other drugs, zonisamide, it's a sulfonamide anticonvulsant medication, generally well tolerated, as they say, but still vomiting and ataxia. Okay, maybe that won't be an issue, and maybe that will all be fine, and maybe that's all you want to do. There are serious adverse effects, though. Now, acupuncture, massage, all these things, they don't cause hepatic necrosis. They don't cause renal tubular acidosis. They don't cause erythema multiforme, which, as you see here in the foot of a child, is a hypersensitivity reaction to drugs or to infections. And so, well, what's the research? Because, hey, if I learned it in school, it means it was the right thing. And I loved my teachers there and they wouldn't lead me astray. Well, that's fine, but what are they basing their suggestions on? And not to rag on teachers, but let's look at what the evidence is, because I know I wasn't told on the basis of how much research there was that they were making certain recommendations that I had to learn and then write it on the test. It'd be just as bad if a TCM practitioner made you learn that the spleen gets damp, and when the spleen is damp, then you get diarrhea. So to pass the TCM test, you have to say, yes, the spleen causes diarrhea when it is waterlogged. But you know that's not right. So here, canine research on zonisamide, 2 small studies, 5 or 10 dogs, 2004 and 2013, about 60% of dogs showed improvement. Well, that means 6 dogs out of 10. If it was one less, then it's like it's a toss-up. It's, get a nickel out and is it heads or tails? Then a more common one is potassium bromide, or it might be more familiar to people. And this is actually potassium bromide, flanked on either side by potassium iodide and potassium chloride. And it's just this white, salty-looking substance. So just a little bit of history, because we all need to know more about history, obviously. So the anticonvulsant effects of potassium bromide were first acknowledged in 1857 in the UK at a meeting of the Royal Medical and Surgical Society. And it had been of interest in the troops because it said that it had been noted to calm sexual excitement and to reduce seizure and nervous disorders. It was just very kind of depressing down. And hospitals then would be using several tons annually for patients, and I already showed you what it was. It's actually a clear solution, but sometimes it will be colored pink by certain providers, just so you see that's a medicine, it's not water, so don't drink a whole lot of that at once. And then by the early 1900s, the term bromide became a metaphorical description to apply to a dull, sedated person, because that's what potassium bromide does. And that's kind of like the problem with a lot of these anti-epileptic, anticonvulsant medications is it's making it so your brain isn't going haywire and firing synchronously and just woo. So it's calming it down, it's smushing it down. And is that all we have? Is that all we should expect to have? But anyway, so then phenobarb was first used as a medication for convulsions in 1912. And so we have various things. This is an old, like sort of apothecary chemistry scene here with sodium bromide, which is what was in bromo seltzer, if you remember that. And so these bromides were used medicinally, and bromo seltzer was used for headaches. So still something, mental, and that was an over-the-counter sedative and headache remedy. But then it was outlawed in 1975. I mean, I was alive then, as an over-the-counter medication due to chronic toxicity. Yeah, this headache is killing me. Yeah. It was billed as a cure for exhaustion and other problems. And then, as they used to say about women, with nerves unstrung and heads that ache, wise women bromo seltzer take. That was their ad. So anyway, it recurred online as a fizzy tablet for, just various ailments. But the problem, even with potassium bromide for seizures, is it has an exceedingly long half-life, 25 to 46 days. And that's one of the issues. So when you have side effects with drugs, whether it's the typical ones that we've been seeing, pelvic limb ataxia, polyuria, polydipsia, problems with appetite, sedation, lethargy, nausea, vomiting, then it's going to take a while to get that out of your system and to change course. So anyway, the worst adverse effects than those are potential pancreatitis, aggressive behavior, and there's a high risk of pneumonitis or lung inflammation in cats. So not really a good thing for them. So maybe it's time to try another approach. And we've hit on that a bit before, and I will launch this poll. So everybody get ready, take the poll. How often do you discuss seizure precipitating factors with clients? So ask them about, what kinds of things prompt your dog to have seizures. That would be the factors. Do you never describe that? Do you sometimes, in those different percentages, 25, 50%, 75%, or 100% of the time? And I will launch this poll. So you have a little bit of time to take it. Go ahead and vote, and you get one answer. And I don't know who you are, so you can feel free to participate and admit that you don't really talk about precipitating factors, because as you're thinking about this, so much of what we want to do from a non-drug, non-surgical approach is prevent problems. So how can we see what's going on, and if there is a factor, maybe stop that factor? Okay, I'm going to close the poll and share results. And so none of you never did it, and 2/3 of you did about 50% of the time, and then 1/3 of you 100% of the time. So good job with that. So you're doing asking about some of the factors, which is nice, and that's the way in that we can begin to have this dialogue. Now, if we're working for a certain type of practice and we have 5 minutes, how much are you going to squish into that 5 minutes? I guess you could have them fill out a survey. But anyway, so when we talk about factors, we want to talk about what's precipitating seizures. And again, this disordered but also synchronized brain just frying chaos and problematic firing. Now, in humans, there are known epilepsy precipitating factors or triggers: stress, change in medications, cigarettes, TV or computer. I mean, why wouldn't animals be susceptible to this too? Stress, change in medications, secondhand smoke of any type, continual, news shows on and or gaming or something, just too much noise and flashing lights and a lot of stress. They wouldn't necessarily get alcohol, but again, the video games, just somebody that is completely tuned out to your needs and stressed out and doesn't want to be bothered, and there's all this noise and chaos, bright lights and hormonal imbalance. So if we then look for evidence of factors in dogs, here's a study from JAVMA in 2017, and just looking first at the dogs. This was maybe the first study of its type, and that was in 2017, so that was just a few years ago. Many of you might have graduated decades ago. It's hard to say. I know I did. So as they say, A variety of sedatives and maintenance epileptic drugs were administered to affected dogs that failed to prevent the stimulus-specific seizure activity. So you can recognize that there might be triggers, but seems like sedatives and maintenance drugs aren't fixing them. And so in this study, they concluded that the results of the present study suggested that seizures provoked by specific situations or locations occur in dogs with reflex epilepsy, so responsive to some kind of trigger, and that common triggers, note to self, were visits to veterinary and grooming facilities. So when we think about cat-friendly practices, when we think about fear-free practices, it's not just because we're touchy-feely. I mean, like me, I used to live in Boulder for a while, and we just loved all the doggies and the kittens, and we just want them to be nice and liked and everything by us and everything. So, but there's real meaningful reasons why we need to intervene and stop stressing our patients out. And when there's a better mood and culture within the clinic, then our animals are going to not get as stressed out. So that's worth considering there. So then, just last year, 2019, here's a study out of Finland. They tend to, overgeneralizing, but I like a lot of the studies that come out of Finland. Seizure precipitating factors in dogs with idiopathic epilepsy. Now here's 50. Oh my God, 50 dogs. That's a lot of dogs for these studies. Diagnosed with idiopathic epilepsy, and 74% were found to have seizure precipitating factors. So as they go on in their study, and this is online free to download, 58% of clients reported that their dog, so they noted that their dog had precipitating factors for seizures when choosing from a checklist, though. So instead of an open-ended question, they were asked more this checklist, closed-ended question. So which ones provoke seizures in your dog? And at least 3/4 of them nearly recognized at least one factor. So from the open-ended, like, what do you think makes your dog have seizures? Stress and excitement, 21%, and hot weather, 17%. Well, hot weather is stressful, stress is stressful, excitement can be stressful. So again, we're looking at the problem being an agitation, a throwing off, a too much activity in the brain that is just driving their brain nuts. And that's what helps explain why the treatment is to just sedate it to numbness, and then they won't have seizures anymore, but then you don't have your same dog. And yes, thank you, Shutterstock, for these stock photos. But when you look at them, I mean, especially any animal photos, I wonder, how did they get that photo? Is that really right for the animal? So I do think about that when I choose them, and sometimes I worry about it. But here, I mean, is the dog loving this situation, or is the dog saying, Mom, get me out of here? And if we think about this in terms of the summer and 4th of July, fireworks, family, a lot of people around, then that is stressful. That was on the checklist of this Finnish study. Visitors at home, changes in life situation. We also see this with COVID. I mean, people getting displaced from their home, all kinds of things, changes in daily routine. Mom, you're giving me a seizure. Why don't you just go back to work? Altered sleep patterns, unfamiliar places, again, getting displaced, losing your home, and weather changes, especially excess heat. So what's the common factor? Well, stress, and maybe it's us, and that our animals are so tuned into us that are we giving them seizures? And so just looking at how we experience stress, there's the wandering uterus of hysteria, insomnia, headache, depression, and anger. All those can be manifestations, and dogs have their own versions of things. So in the conclusion from this study, they talk about that there are frequently recognized factors, and these, keep in mind, are just what clients are admitting to, are noting, have observed. I mean, they're not with their dog necessarily 100% of the day, and if they are, they're stressing them out potentially. But so this is just like an overall early sweep of what kinds of things are contributing to epilepsy, and giving us, if you are a scientific integrative medicine practitioner like me, then how can we intervene? How can we prevent things? And how can we solve the problem from actually the issue, rather than just covering up with lots of depressant CNS drugs? So clinically, when a dog is diagnosed with epilepsy, as they say, seizure precipitating factors should be taken into consideration to achieve better treatment outcomes. So here's another poll. Have another poll. And do schools teach how to approach animals in a stress-free manner to avoid inducing seizures? Think back when you were in school. Were you told about how to be very calm around the animal, to treat the, be careful about how you work with them? Or do you remember being in school, like I remember being in school and just like wanting to just leave the room oftentimes when there would be an animal being examined, whether they were having a seizure or not. So I've launched the poll, and you can say most do or do not, or you don't know, teach how to approach animals in a stress-free manner. And then keep in mind as well that as we're seeing this fear-free certification and practice happen, I'm frequently amazed at how many schools say that they're doing it, the fear-free certification and principles, but even private practices too. It's like you just have to really reinforce this, because it's not always what might be happening, but it's a good start. And we just need to make it a whole culture shift, and then we should be good. So I'm going to close the poll, and yeah, share results. Most do not. I agree with you. Most do not. Okay. So as we go on, we have these factors, stress. So what can we do to limit stress? We have brain activity disarray. What can we do to fix the brain? Neuromodulation. Oh, another poll. How can we reduce stress and neuromodulation? And you can choose any of these. Regular moderate exercise, comfortable, quiet, calm living conditions, appropriately researched botanical medicines, parasympathomimetic type of acupuncture, or all of the above. So there's your poll. I think you might just get one answer to take, because I have the all of the above there, and everybody has voted. And I'm going to close the poll and share results. Yay! Yay for you! We can use regular moderate exercise, quiet, calm living conditions, and comfortable, appropriately temperatured, and then herbs potentially too. We are thinking of CBD, I know, and parasympathomimetic acupuncture. And I am specific about parasympathomimetic acupuncture because that means that we are not using heavy-handed approaches like with thick needles, and having a lot of restraint on the animal and just making them stressed out. That should never be how we practice acupuncture. I know there are schools that teach that way. We are teaching CuraCore, nice mechanoreceptor stimulation acupuncture. And when you know the neurophysiology of the points that you are activating, specific points like stomach 36, GB20, different other points, some studies use GB20, Feng Qi. And so once you understand how you are affecting the nervous system, central, peripheral, and autonomic nervous system, in accordance with our main approach, which is coming up next week, but and which we teach in medical acupuncture for veterinarians, if we know how to select points and how to stimulate in a parasympathomimetic fashion, then we are going to get better results, because you can also find studies that say acupuncture wasn't working. Well, how was the acupuncture done? What points were chosen? What was the end goal? So this is where science comes forth in acupuncture. You have to know what the nervous system is going to do with your input. So to answer some of these other questions and see what else we can do, let's go shopping online at pubmed.gov for free access online. Here is a study on auricular electroacupuncture. Now, this was late post-traumatic epilepsy after severe brain injury, a retrospective study. This is from evidence-based complementary and alternative medicine, but it's from 2019, so this is recent. This is from last year. And yes, this isn't the idiopathic, I don't know, or genetic type of epilepsy, but it's still epilepsy, and so still a brain disorder. So common complication of traumatic brain injury, which seriously affects patient survival and recovery. Still something has happened, and oftentimes this vagal nerve stimulation will be done, and that's where you have a nerve stimulator, pacemaker implanted in your neck. Oh, whoop-de-doo. And that can have some anti-epileptic effects. But what else could we do? Well, we know, if you've been to my course, the auricular branch of the vagus nerve, which in dogs is going to be this middle third here, but in us is this deep inner part here inside the concha. That's what the auricular branch of the vagus nerve supplies. It's the only peripheral branch of the vagus nerve, and it has epileptic effects because it's parasympathomimetic. And so here they analyzed that with ear acupuncture and compared it to some of the drugs. So did they get auricular or ear acupuncture or not, and compared with the control group, which did not get the auricular electroacupuncture, there were more seizure-free cases in the auricular electroacupuncture group. That was significant. The total effective rate of the auricular group was 90%. Seizure-free rate among patients treated with auricular electroacupuncture was, so I think their wording here was messed up, but it was shown to be significant. So here I copied it from the article itself. Compared with sodium valproate, edaravone, and conventional vagal nerve stimulation, auricular electroacupuncture is effective for reducing the incidence of late post-traumatic epilepsy via the stimulation of the auricular branch of the vagus nerve. Case done, mic drop. The use of auricular electroacupuncture can help to avoid the side effects of vagal nerve stimulation, and it is a safe therapeutic option for post-traumatic epilepsy when performed by qualified doctors. Thank you very much. This is the vagal nerve stimulator. Yeah, Shutterstock has it, but sometimes they don't spell things correctly. Vagus nerve. The vagus nerve is here, and then we have electrodes. A vagus nerve stimulator is in here. I mean, so how would that feel? Why do we have to go sticking machines underneath our skin and around our nerves in order to get vagal nerve stimulation when, hello, we do that all the time with acupuncture? So anyway, but who's going to make money off of selling acupuncture needles? Maybe a vagal nerve stimulator is more expensive, which it is. Anyway, how does this work? Well, your vagal afferents project to the nucleus tractus solitarius in your brainstem, which we talk about, and then that influences the activity of so many other brain centers. And because of that ubiquity of its sharing its good vibes, then that can ultimately affect the epileptic nidus. And instead of the synchronizing thing, which is the seizure, then you get desynchronized, and that's what you want on the EEG. Now, newer evidence is also showing that the neuroadrenergic site, which we do mention a little bit in the acupuncture course, the locus ceruleus, also participates in the anti-epileptic effects of the vagal nerve stimulation. Now, if you're going to implant a nerve stimulator, yeah, that can give you a cough. No wonder. It's in your neck. It's on your nerve. It's irritating. It's got wires. Vocal alteration, hoarseness, and tingling. So what's better than that? Acupuncture. And it shouldn't leave anything behind. And we do not recommend gold bead implants or any kind of leaving behind metal objects. Auricular acupuncture stimulation activates this auricular branch, and being parasympathomimetic, it's also anti-inflammatory because it's cholinergic in its effects, and anti-inflammatory effects are also anti-seizure. Here in 2016 from Epilepsia, we move on to exercise. Generally, human epileptic patients have been discouraged from doing exercise because they're like, well, what if something happens? Well, if you are being careful and calm about it and you do low-risk activities, then it's actually something to endorse, and for the health benefits of regular moderate exercise and just things that, I mean, probably not horseback riding, I don't know, but things that you're not going to get hurt at if you start to have a seizure. So here, this is our final poll. I learned about the endocannabinoid system and cannabis in veterinary school. Agree, disagree, or I just learned very little. So I'm going to launch that poll, and you can take that, and that will be our final poll. So good, everybody voted. I'm going to close the poll, share results, and yeah, still not taught. And I would think any of you that are currently vet students or are recently vet students, yeah, we've always had the endocannabinoid system. It's very significant, and yet we're still not learning about it in most neuro classes. So just looking now at the cannabis approach to seizures, here from Frontiers in Neurology 2018, potential clinical benefits of CBD-rich cannabis extracts over purified CBD cannabidiol in treatment-resistant epilepsy, observational data meta-analysis. So this gets to that next step where are we going to just stay with CBD, or are we going to look at these CBD-rich extracts that are squished out of the cannabis plant that have things we've talked about in our cannabis meeting, the flavonoids, the terpenes, terpenoids, various cannabinoids beyond CBD, whether it's CBN or CBDA, anything like that, or even teeny little bit of THC. So patients treated with CBD-rich extracts reported lower average dose than those using purified CBD. So keep this in mind when you're looking at studies, even if you are thinking about treating an animal with something that they claim is predominantly CBD. The reports of mild and severe adverse effects were more frequent in products containing purified CBD than in CBD-rich extracts. CBD-rich extracts seem to present a better therapeutic profile than purified CBD, at least for this group of patients with refractory epilepsy. And the roots, so to speak, of this difference are likely due to synergistic effects of CBD with other phytocompounds, which has been talked about as the entourage effects, but as I've recently lectured to some, there's debate about whether it's really an entourage effect, which suggests synergy among all the different components, the cannabinoids, the terpenes, the flavonoids, or is it more just an ensemble effect that they're all there, but it's not like they're interacting in any way, which is getting to seem like that's the point. But we need to have more controlled studies. So the roots of this difference likely due to the synergistic effects. Okay, and then here's the study from CSU from JAVMA 2019, randomized blinded clinical controlled trial to assess the effects of oral cannabidiol administration in addition to conventional anti-epileptic treatment on seizure frequency in dogs with intractable idiopathic epilepsy. So here's where whatever the dogs were on previous to things going on, they were kept on that, and then CBD was added. And I believe that the mixture they used was a predominantly CBD-rich extract made close here in Colorado, I think in Loveland, at least the company I think is in Loveland. And so here's the abstract from it. They were given either CBD or placebo. And look at these numbers, 12 or 14, woohoo. And so their dose, CBD infused oil, these are dogs, not people that we talked about just recently, 2.5 mg per kg twice a day for 12 weeks, in addition to the anti-epileptic medication. And then the placebo group received just oil without the CBD. And then they measured the effects. 2 dogs in the CBD group developed ataxia and were withdrawn from the study. Well, okay, so ataxia, but that's not necessarily the end of the world because we saw other epileptic drugs giving dogs ataxia. So what would happen in clinical experience? We might adjust the dose. Or dogs might get used to it, or maybe they aren't on anymore. But for the study, they eventually had 9 dogs in the CBD group and 7 in the placebo group, and there was a significant change, a significant reduction in the seizure frequency, but they wanted to get to a 50% reduction. And so now they're doing a bigger study that AKC is funding. So anyway, but no adverse behavioral effects were reported by owners, so no aggression like with high doses of certain medications. Dogs in the CBD group did have significant increase in serum alk phos, but we see that in medications as well. Typically if anything's going to happen, they're going to get drowsy, but not to the profound levels as these drugs can make. So anyway, so more research is being done. But so now we know it's not an untold story. If we can get this information out, if we can start to have veterinary schools teach it, or at least veterinary students seek information like our PBM Prima program where, okay, you just learned this other stuff in your 8 to 5 school, and then we have an online course, 5 hours each semester, I believe, on the diversity of integrative approaches that are part of Prima practice. And now you know this other thing. And so when you raise your hand and say, what about acupuncture? And even if they try to shut you down, it's like, what about parasympathetic effects? And they're like, will you be quiet? What about stress? What about precipitating factors? I never sat at the front of the room. I sat at the back of the room, but I still caused a bit of trouble. Take a better history. Find out the precipitating factors. Are they left outside all the time? Are they in the cold? Are they in the heat? Are they being crowded? Are they abandoned? Are they not fed regularly? What is the type of food? What is the quality of food? So many different factors to find out and really intervene. It's just like children with a suspected congenital seizure disorder. Maybe they have something else going on, heavy metal toxicosis or something in the family, or having some kind of breast milk, problem that's coming through the mother. If we are better historians, we will be better physicians or veterinarians, as long as if we are doing a better exam, that we're going to palpate the animal. We're going to be connected with them and see who is this individual. Do they have a tremendous amount of neck tension like I can see in this dog? Are they just overwhelmed with this body that they're in with all the problems that they have? And then, potentially being dragged by the neck behind a bike or something. And it's like, oh boy, that's going to screw up your head. So we can offer better options, and that's what we should be doing, and that's what the Untold Story is about. So thank you for joining me for this first version of the Untold Story on the treatment of seizure disorders in dogs from a scientific, integrative medicine and rehabilitation standpoint. If you are interested in our courses, we have the human and the veterinary approaches, but CuraCore Vet, curacore.org/vet will get you to the multiplicity of courses that we teach, all from a science-based perspective. So again, thanks for joining me, and I will see you in a couple weeks. We're teaching our acupuncture course next week, so we're taking off, but then we'll follow that with the medical acupuncture and integrative neuromodulation approach. Thank you so much.